Hello, today's episode will be about walking with crutches. I am after a minor orthopedic surgery on my foot, so this is a perfect opportunity. I will show you how to adjust the height of the crutches. We will focus on the elbow crutches. I will show you how to use them during walking with 2 crutches, with 1 crutch, and how to climb the stairs. Stay with me. There are different types of orthopedic walking aids. Their selection depends on many factors: the type of disease, the patient's fitness, whether he or she is obese, dizzy, etc. We will offer a different walking aid to a young patient after knee surgery and a different one to an elderly patient after a stroke. But today we will focus on forearm crutches, which are the most popular form of mobility aid in Europe. Interestingly, in the United States, axillary crutches are mainly used. How to adjust the height of the forearm crutches? The forearm crutches are adjusted using standard clips. The clip should be pulled out and then the crutch should be lengthened or shortened accordingly. The height of the forearm crutch will be correct if the handle is at the level of the greater trochanter of the femur. The greater trochanter of the femur is the most lateral part of the hip, palpable through the skin. If, holding the crutches resting on the ground, our shoulders are relaxed and our posture is straight, it is good. If our shoulders go up in this position, it means that the crutches are too high. If we have to bend down, it means that the crutches are too short. We start by walking with 2 crutches. First, move both crutches forward. Then, take a step with the affected leg. Of course, we do not put weight on this leg, we just place it where it would normally stand while walking. Then, add the healthy leg. Crutches, injured leg, and then healthy one. If it is going well, you can speed it up. Pull both crutches forward together with the affected leg, then add the healthy one. Crutches with the affected leg, add healthy one. It is a mistake to keep the injured leg up and to jump on one healthy leg. This disturbs the normal gait pattern and you should not do this. The affected leg, even if, as in my case, the surgery was on the foot itself, should be placed where it would be if we walked normally. Stairs. The rule here is simple. Healthy goes to heaven, injured goes to hell. So, healthy leg goes first if we go up the stairs and injured leg goes first if we go down the stairs. Going up the stairs. First, rest your body weight on both crutches. Move your healthy leg to the step above. Then, add the affected leg. Crutches, healthy, add injured. Crutches, healthy, add injured. Walking downstairs. With your weight on your healthy leg, place both crutches on the step below. Step down with injured leg, add the healthy leg. Crutches, injured, healthy. Crutches, injured, healthy. Elderly patients, obese ones, patients with balance disorders are often afraid to go downstairs because the correct technique requires in the first phase of movement to tilt the center of gravity forward. Many patients are afraid to do it because they feel like they will fall down the stairs. For these patients, a perfect trick is to teach them how to get down the stairs backwards using the railing. Patient stands in the direction as if he or she were going up the stairs. Holding the handrail with one hand, rest your body weight on the healthy leg and place the crutch on the step below. Then step down with the affected leg. Next, add the healthy leg. Crutch, injured, healthy. Walking with 1 crutch. The rule here is simple. The crutch should always be on the side of a healthy limb. Start by positioning the crutch forward. Initiate a step with the affected leg and then add the healthy one. Crutch, injured, add healthy. Crutch, injured, add healthy. If you are doing well, speed up. Crutch together with affected leg, add the healthy one. Crutch with the affected leg, healthy one. That's all for today. Thank you for watching and see you next time.